Now we have one more discussion, and that is ibuprofen, which we very commonly see with tablet, Combiflam, and the paracetamol. Now both these medicines are NSAIDs, but the main difference is this paracetamol has a very weak anti-inflammatory property, whereas ibuprofen has is one of the standard NSAID and it has good anti-inflammatory property. So this anti-inflammatory or inflammatory properties, how does it help us? The main difference is whenever there is inflammation, whenever we say that patient has inflammation, there is increased blood flow to that particular tissue, whether it is muscle, bone, whatever it is. So wherever there is inflammation, there will be swelling, there will be pain, there will be tenderness, there will be redness. So if this has good anti-inflammatory property, it means ki this ibuprofen is supposed to reduce the swelling, reduce the pain, reduce the tenderness, reduce the redness. So whenever there is inflammation, that can happen very commonly with surgeries, with injuries, with trauma, with fall, we are with some disorders like rheumatoid arthritis. It is an inflammatory disorder. With gout, the uric acid crystals they get deposited in joints and that cause inflammation. And inflammation causes all these symptoms. So no matter what surgery it is, what injury it is, inflammation is almost always there. And very commonly, this inflammation raises the local temperature of the tissue, as well as if it is persistent, it can very commonly create the fever. So this ibuprofen has half-life of around 2 to 4 hours. Also, the paracetamol also has half-life of around 2 to 3 hours. So very commonly paracetamol acts for around 6 to 8 hours, whereas brufen also acts for around 6 to 8 hours and it can give a very good analgesia effect. The dosage of ibuprofen is around 400 milligram to 600 milligram 3 times a day. So we can give almost around 1.2 to 1.5 grams of ibuprofen per day, whereas paracetamol very commonly most of the time 4 grams per day can be used. So paracetamol is found in 650 milligram, 500 milligram tablet, and most of the time patient can be given 650 milligram up to 3 to 4 times a day very commonly, but most of the time it is used up to 2 to 3 grams per day. More than 3 grams usually is very not commonly used. We can very simply calculate the dosage of paracetamol by 10 to 15 milligram per kilogram every 6 to 8 hourly. This is the dosage of the paracetamol, whereas in ibuprofen the dosage is up to 10 milligram per kilogram that can be given 3 times a day. It is labeled as one of the safest analgesic amongst the NSAIDs, and as I told, it has a good anti-inflammatory property. So it is very commonly used with osteoarthritis, soft tissue injuries, cellulitis, dental pain, post-operative pain, to reduce the swelling, for renal colic, abscesses, trauma, gout, because all these things there is some portion of inflammation involved or significant pain involved or tenderness involved or redness involved. That is the reason why ibuprofen is one of the good medicine for these pains, whereas this paracetamol does not have that much of a great anti-inflammatory property. So this is not as effective in joint disorder or significant swelling disorder. Like it is not very good medicine for osteoarthritis or soft tissue injuries or cellulitis or dental pain or post-operative pain or to reduce the swelling. Paracetamol is not as great as ibuprofen. So it can definitely be reducing pain, but not as good as ibuprofen. So if on pain scale 0 to 10, if ibuprofen can reduce the pain by around 6 to 7, paracetamol will hardly be doing that, up to 2 to 3 only. So paracetamol can act as an additional or additive painkiller with ibuprofen, but on its own, it cannot give a very good anti-inflammatory analgesic effect when it comes to osteoarthritis or soft tissue injuries or cellulitis or dental pain or post-operative pain or for inflammation or renal colicky, abscess, trauma and gout. So, paracetamol has a very good antipyretic effect. So, if someone has fever and if the patient does not have that much of pain, then paracetamol stands the first drug to give for fever as it has weak anti-inflammatory effect. The analgesia effect or pain relieving effect of paracetamol is through central analgesic activity as it raises the pain threshold. So paracetamol can be given for pain, for milder pain, but if the pain is moderate to very severe, if the pain is related to inflammation, trauma, muscles, bone, joints, then paracetamol can be given as an additional pain relieving drug when compared to other drugs. The good thing about the paracetamol is as it does not have any anti-inflammatory effect, it has no bad effect on the heart system, so it is safe in heart failure. It does not cause any nausea, vomiting, gastric upset, which is very common with ibuprofen because this is a standard Nsaids. That is the reason why it has to be used very cautiously in patients with heart failure, in patients with diabetes, and it can significantly cause nausea, vomiting, gastric upset. So pantoprazole or esomeprazole or rabeprazole or with probiotics can be needed with ibuprofen, which is usually not needed with the paracetamol. So this was all about this ibuprofen and paracetamol, and thank you so much.